Hi guys, hello again. It's your personal dental insider. I wanted to show you and explain to you just a little bit about the different type of x-rays that are taken. This one, of course, most of you might know. For those of you who don't, it's called a panoramic radiograph or panoramic x-ray. Why is it a panoramic? Because of course, as you can see, it's showing from one corner of the mouth to the other corner of the mouth. In other words, one end of the jawbone to the other. So this area here, how you can tell the difference is look at that smile line. See a smile line here. So this is the lower jawbone. The way you can tell the lower jawbone, if there wasn't any teeth, is actually if I go in a bit closer, if it will show you, it's more like a cobweb consistency, the bone, as opposed to the upper one. Do you see all these little gray shadows in between? Those are the sinuses. So that's where your nose would be, if there was flesh on this thing. Okay? So this is the upper, and this here would be your sinus. A lot of times this even looks more whiter than it's supposed to, because sometimes earrings are left in the earlobe, which is right here. When the earrings are left there and the machine, that's this, when it goes around the head, of course, because it's it's taking a picture of the flash, it superimposes on this, and then this line here looks like a straight white line across because it's the reflection of one earring to another. So most times, you're not able, or the doctor is not able to see the roots of these teeth. But with this one, you can see the roots are clear. Let me go in a bit closer. Do you see that? You can see a bit closer, and there goes the lower jawbone or the mandible. There it is. And the upper. So this one, of course, shows you from one end to the other. So that's a panoramic. There's a brief description of it right there. Tells you what a panoramic. This is, of course, is my old dental book. All right, so let me show you another view. And these are individual films. They're called periapicals. These individual films will show you each individual tooth. So if you go into the dentist and says, oh, I got a pain here or a pain there, they ask you where it is. And immediately, the assistant would actually take a picture of that particular tooth, and they would work on that area alone, depending on what your concern is. But when you go in as a new patient, then of course they will take several of these individual films. If you notice this one where the teeth are biting together, exactly what it is. It's bitewings. And of course you can tell the ones in the back because of the smile line again. It goes up like that. And the premolars and the molars. And these are fillings in the teeth. Again, we'll talk about that some other time. Once I have the treatment plans and we're reviewing them or answering questions about them, we'll talk about that. And in a previous video, you will see the pulp of the tooth. You can see them listed here as well, highlighted there. And here is what's a full mouth x-ray is. I think there's a video before that actually shows that as well. And this person has quite a few fillings there on all their back teeth or their molars or their grinders. And you'll see the lower teeth, the anteriors. And of course, some people say these are your two big front teeth or your centrals. So I just wanted to show you the radiograph. So this is what, and this here with this space here, this is what's called a bridge. So these two teeth that supports this one that's missing in the middle, they're abutments. And the one that's missing, that's not there, that this little tooth is supporting, would be a pontic. Of course, We'll get into that some other time. Not too many terminologies right now, but that's what this is. And you notice that this one looks a bit different. This pulp looks different from that pulp. Do you see the difference with that one? See that? You see that right there? Those two lines into the nerve. So this tooth actually had a root canal. It actually had a root canal. See the difference with that one with the filling as opposed to that one? Okay. And that's a bridge that's on that. And that's on the lower. So just to let you know more about full mouth x-rays, FMXs series, or periapicals, PAs. See individually what a view of that tooth. Okay, see the cobwebs that I was telling you about, how you can tell when they're the lowest. See that those little lines? Here it is. See them? And look at this one that shows you the sinus. That's the upper. See the difference of the bone structure? Okay, that's how they're able to tell. See? That's how they're able to tell an upper film from a lower film. So when you see them on your next dental visit, when you go in, you know exactly the upper and you know what the lower looks like, because you're looking for, you'll see that smile line. If you're looking at any of these, you'll see that smile line and you'll know based on that cobweb consistency, that's the lower. And based on this line, that this is the sinus. So right away you know that this is the upper. And how you can tell from the left or the right, most times they have them numbered. But I'll show you another diagram that has the teeth numbers on them and you'll know which is the right side. The right side are the lower numbers, starting like 1, 2, and 3. And over on the left would be the 13, 14, 15, 16, and so on. Okay? And the right side for the lowers would be the largest number, 31, 32. All right, so just to give you a bit more summary on the x-rays, what those will look like. Your bite wings, that's where they're looking for cavities in between the teeth. So that's what the bite wings are. So when they tell you that, okay, go ahead, can you bite down for me and just make a smile but still keep biting? They want to see how you close or how you occlude, and they're looking to see if there's any cavities in between the teeth. Okay. All right. So again, send me a note, comment, send an email, any questions or concerns. When was your last visit at the dentist and what were your concerns? What challenges did you leave confused even though they spent some time talking with you? Did you feel pressured and you left there and it was so much information that you didn't understand it and you're a bit hesitant about going back in for treatment? Just send me a message. I'll be more than happy to assist you and walk you through the process. Remember, your personal dental insider. I am here to assist you to get you back to healthy. So I'm looking forward to hearing from you. Any other questions or concerns you have about any reason or any obstacle or anything that's hindering you or causing confusion, that's stopping you from accepting treatment or not making the decision to go in to have treatment done. Okay? So until we talk again, send me those emails or those chats. We'll talk.